right lobe. This is right lower lobe. Hilum is a little bit far, and it's nearer more to the diaphragm. So, okay. So, you just read and check all of the lesion because it's already given there. I would like to move on with the other um, lesion aside from pneumonia. Now let's move on to the pneumothorax. Okay, pneumothorax. There is a entrance of air inside the pleural space, causing the lungs to collapse. Because the covering of the lungs is pleura, right? The visceral and parietal pleura. It actually happens when there is sample puncture of the heart or idiopathic causes. But most commonly, pneumothorax is usually due to um, what you call this accident. So in pneumothorax, let's go back again to the normal lungs, normal looking lungs. So the lungs must be a little bit blackish and white. So this one is a normal lungs, right lungs. And the left lungs has pathologic condition. Why do you think so? Is that if there is loss of there is air in between of the parietal pleura, so you can delineate now that this arrow here is the parietal or the pleura of the patient. And you can see that the lung itself, the lungs, lost a little bit of its air inside. That's why it's not anymore this a little bit dark here. So let's compare it again with this picture. Normal lungs, the lungs parenchyma is usually adherent to the covering, the parietal. But once there's is air inside of the pleura, the lungs will be compressed, making it little, looking like smaller lungs, while in between will be too much dark. Though you cannot really appreciate from here. Let's move to another example. Okay. Sige. Okay. For this is the one I wanted to show you. This is so it's not really obvious. This is the pleura. This one, deep sulcus sign. In this um, image, again, this is lungs, so there is pathologic process ongoing here. So this is lungs which has still air inside compared to the left side. Okay, in the left side, you will see that it's totally in between of the ribs in the lower lung, left lower lobe. There is already too much black here. So you cannot anymore appreciatively see the pulmonary blood vessels or the blood vessel of the pulmonary going on around in this area. So at this area, no more pulmonary blood vessel. It's only up to here. So this person might have a pleural effusion. This is what we call deep sulcus sign. So actually, this is done when a patient is in a supine position. So air travels to the non-dependent portion of the lungs. Okay, so this patient is in the lateral decubitus. You know, when you are due to gravity, air will be pushed to the upper side. So I cannot move my So this supposedly will be looked in this side. This whole picture must be looked at this side. Okay, like lungs. So you have to look on this side. So this is the lungs. This is the right lungs, left lungs. So due to gravity, air will travel to the uppermost. But I place it on the upright position. So if you move your device, make it in the side way, you can see that the air travel to the most upper side or upper part of the lungs. So here, the problem here is the left lower lungs. The problem here is actually the left lungs actually become smaller because there's air that goes inside in between of this parietal pleura. So there is increased lucency or blackness on this area. And how to confirm if there is air that travels to the lungs? Of course, you have to do another imaging, CT scan. You can see here the right lungs. Again, in CT scan, always right side here, left. Okay. The normal lungs in this area has still the blood vessel. It's a dark where they're here. But in this, comparing to the left side, you can see that the left lung already becomes smaller, surrounded by really darker area here. This is a air that goes in between of this pleura. So, causes of pneumothorax, it could be spontaneous or traumatic, someone stabbed. Iatrogenic, when doing lung biopsy, if there is a tumor. Asthma, especially those chronic or severe type of asthma, where the alveolus become ruptured, causing bleb, or COPD and cystic fibrosis. So here, which side of the lungs has a pneumothorax? Anyone? Which side? Correct. What? No. Which side of the lung here has a pneumothorax? Left lung or right lung?
Right.
Left. Why left?
Left.
This is right.
This is not.
Which side has pneumothorax?
That side.
Right. Right.
Right. Because you can see the lungs here become small, while the normal lungs is supposed to look like this. And you can see there is a full blackness of this area, meaning there's air in between of the ribs, or air, if you want to imagine it, there's air in between of this rib cage and the lungs. So I will remove my drawing so you can see that the lung, the parenchyma of the right lung. Here is the lung parenchyma. See, it's only up to this side. And this area is the air. So this is pneumothorax. If there is pneumothorax, okay, we already identified the pneumothorax. What do you think will happen to the structure in the middle? It will be shift to the left or stay still, or it will be shift to the... Again, my question is, if there is air here and the lungs collapse, what will happen now to the trachea? There is trachea and to the heart. So of course, it's common, right? That the structure in the middle will be pushed to the left. See here, the border of the heart supposed to be in this side, but it's pushed to the left side. You understand? In pneumonia, no shape of the medial structure. In pneumothorax, there is shift or away. Shift or away. The medial structure will be away from the affected sides. I'm just using different term. So shift to the left is same as away to the affected side. Away to the affected side. What about this one? The pneumothorax is on the left lungs, where actually the heart supposed to be in this heart, but it pushes, so it shifts away the structure. The trachea, it's not really visualized. It's usually push or shift away or push out to the right side. So to make it easier, pneumothorax will push anything that's in the middle. Okay? When pneumothorax happen to the right, it will push the structure in the middle away from its side or to the other side. If it's happened to the left, it's vice versa. So you will not be confused. Okay? The pneumothorax, there is air. Of course, it will push the structure away from it. Okay, I'll be finishing. I want to atelectasis. Atelectasis Atelectasis happen when there is a loss of volume of the lungs resulting from incomplete expansion or collapse of the lung parenchyma. It causes an increase in density or wideness of the affected site. So, what I meant to say in atelectasis, the lungs itself will be smaller. The lung itself will be smaller because due to loss of air. So, in this side, in the right side of the lungs, since the lung lose its air, no more air inside, so it will become more denser on the right upper lobe of the lungs and also in the middle. So you can see that the tissue, let's say you imagine it a tissue without air. So it will look more wider. Let's see here. Here, the atelectasis is seen in the right upper lobe, right lower lobe. Because here in the normal right lungs, you can see that there is still lucency, but in the right, it appears more wider, meaning the lungs parenchyma loses the air. So when the lungs loses its air, it becomes more wider. In this side, it's on the right middle lobe. Okay, right middle lobe become more dense here. Okay, you just read the cause of type of atelectasis. And in atelectasis, what will happen in atelectasis? What will happen to the structure in atelectasis? If pneumothorax, it will push the structure in the middle away from it. What about in atelectasis? Since the lungs become smaller, those in the middle structure will shift to the affected side. Okay, to the affected side. So pneumothorax, the middle structure away from the affected side. Atelectasis, in the middle structure will be shifted on the affected side. pneumothorax away from the affected side, atelectasis on the affected side. Did you understand? Did you
Yes.
Yes, Doc.
Yes.
So, okay, atelectasis, lungs loses its air. So, when it loses air, it becomes more whiter. Plus, the middle structure will go to its affected side. While pneumothorax, since there's air here, it pushes the middle structure away to the affected side. To compare this, confirm the diagnosis of CT scan, I will not anymore discuss about CT scan because it's not anymore. It's for your third year for radio. Okay. Pleural effusion, there is a fluid like a mass that acts like a mass. Let's see here. So in fluid, always remember in pleural effusion, there's a blunting of costophrenic angle, meaning the angle in between of the ribs and the diaphragm. This is what you call costophrenic angle. So the normal lung that does not have any lesion appears sharp or appears angulated. But if there's a fluid present in the lung, you can see it's blunted. There's a fluid blunted. This is what we call meniscus sign. See here, in AP view, you can see that the costophrenic angle is supposed to be sharp, but when there's presence of fluid, become blunted. If you look at the lateral view, you can see that there's no more angle on this side, but it becomes like a meniscus. You know, when you put water on the glass, it creates this kind of shape. Okay. So, I'll just end my discussion here because pleural effusion, this is actually the summary of the position where it will be shifted. You just read it. And again, a summary. The rest is good to know. You can read it on your own. So, that's it for now. Thank you for tuning. Anyway, there's any question?
No, Doc.
No, Doc.
No, Doc.
So, thank you
No, Doc.
for listening. You may have your dinner.
No,
Thank
Doc.
you. Bye.
Thank you, Doc.
No.
Thank you, Doc. Bye-bye.
Thank you, Doc. Bye-bye. Bye-bye.
Thank you, Doctor. Thank you, Doc.
Bye-bye.
Thank you so much.
வணக்கண்டி மாப்பிள்ள பன்னிரண்டு வணக்கண்டி மாப்பிள்ள பன்னிரண்டு
Director Ravi. Mr.
अबे जहर भाई
தாமஸ் பாண்டா
Hey, Mawe.
தாமஸ் பாண்டா ஒளிக்க